First of all, have you asked your oncologist about um, different possibilities after biopsy or surgery, depending whether the tumor is benign or malignant? Sometimes it's really important to see what the options are before the surgery happens. Secondly, it's very important to ask your oncologist about every single biomarker, every single piece of information that could be available from your tumor. Um, so, another thing to think about whether you've asked them is has my tumor been tested or will my tumor be tested? Um, in a most rigorous and advanced scientific way, just to know which individual mutations to target. Another question to ask your oncologist would be what else could be done other than standard treatment. And you have to understand that most of the time, oncologists would not recommend, would not mention any kind of treatment that is not FDA approved, that is not used outside of clinical trials, and definitely not something that is done outside of the United States. So, a really important question to ask is what are my other options? Is anybody else anywhere in the world treating this cancer in any other way? And finally, definitely, you have to ask your oncologist, what would you do if this was you? Or what would you do if this was your child, if we're talking about pediatric cancer? Because I think sometimes those types of questions elicit perhaps more honest and more personal answers from the oncologist.